Hello, hello. So, this is Audrey, and I'm going to talk about cognitive approaches and treatment interventions. This is really about CBT. So, first of all, what is cognitive behavioral therapy? So, it is a psychosocial intervention and it focuses on changing unhelpful thoughts, beliefs, and attitudes and behaviors. It definitely is all about the relationship between your thoughts, your beliefs, and your behavior. And it's also confronts emotion regulation and definitely is about coping skills. So CBT, I personally use CBT in a lot of my counseling sessions, especially when people definitely need help with increasing their insight so that they can regulate their emotions better and change things in their life and create coping skills. So I'm just gonna show you like this is the typical kind of graph, if you will. I just stole this off the internet of what CBT is. So it's basically the relationship of thoughts, behavior, and emotions. So there's this whole relationship, right? So how we think affects how we feel and affects what we do. So if what we think affects how we feel and act, then it's definitely there's a chain there. There's a relationship. So CBT is where, if you have a certain behavior that you want to change, you would talk a lot about the emotions and feelings behind that and your thoughts and try and change those thoughts so that you can change your behavior. Here's basically a worksheet. So by Dr. Salvini Galperin. So I just, again, stole this off the internet. And this is the kind of thing where if you were doing CBT with a client, you could do this worksheet with them and say, okay, what is the situation? So if the situation is, I'm fighting a lot with my mom. So the behavior you might put in there is like yelling at my mom. And then we'd say, well, what are your thoughts? And the thoughts are, oh, she never listens to me. She always tries to control me. The bodily sensations might be like a tightening of the chest, shortness of breath or something like that. The mood could be like you could be angry or sad or something like that. So what we do is we try to create increased insight into why things are happening the way they are so that you can kind of break the chain, so to speak. So if I want to change my behavior and not start yelling every time someone asks me a question about dinner, then I would have to change my thought process on that and maybe also like withdraw myself from the situation or something along those lines. But it is important for people to just increase insight into why things are bothering them. So bodily sensations in general is always a good thing. Like as a counselor, a lot of times we ask our clients like how does that feel in your body, like when you get angry or when you're sad, like how does that make you feel, because it is increasing their insight into their thoughts and their emotions. So that again, this is just like one little worksheet that you could potentially use. So CBT is definitely short term typically. It's goal oriented psychotherapy. You could do CBT therapy for more long-term counseling, but what it really is about is like more directive, more problem solving, more short-term, like what is the problem? How do we get to the goal? It's very hands-on. It's very much about problem solving. A lot of times it involves workbooks and writing. I can even show you some workbooks if you'd like. The goal is to change patterns in thinking and the behavior that kind of comes from those emotions and thinking, and change how people feel. So I'll kind of grab a couple books here. So I have here's my cognitive behavioral therapy worksheets for dummies. This is actually a good book, believe it or not. Here's another CBT workbook, the anxiety and worry workbook. It's a pretty good one for people with the generalized anxiety disorders. Here's the anxiety and phobia workbook. I have a ton of workbooks, but I really only use parts of them when people come in and they want to work on specific things. A lot of people that I have with anxiety have used this book. It's a pretty decent book, but it's a lot of writing, lots and lots of writing. See all these things where you have to write in here all your thoughts and feelings and emotions. So it's work. It's almost like taking an academic class. It's a lot of work to do CBT. It's not just doing talk therapy. So here are some techniques that CBT therapists use. Guided imagery. That's where the therapist guides you through specific imagery. Like I used to do one with a girl a teenage girl I saw many years ago who had a lot of anger issues, and we talked about a safe place. And hers was like, I think the park in her neighborhood, and so we did a guided imagery of her going to that park and basically finding a way to calm herself down and self regulate. So that was more about emotion regulation for guided imagery. Cognitive restructuring and reframing is where you actively help the client um, change their thought process, literally. So, as a counselor, you would be like questioning their beliefs, trying to get them to think differently about it. Also, reframing. Reframing counselors do all the time, which is when we're basically saying, you tell us a situation and we're like, have you ever thought of it differently? Have you thought of it this way? Questioning people's logic. Reality testing would be part of that. I've done a lot of reality testing with clients that I have that might have paranoia or psychosis or any other things where their reality doesn't seem to be very aligned with what might actually be happening. Activity scheduling and behavioral activation. So that would be, they do that a lot with children with that kind of CBT. So where you really plan things out activity wise. You can also do it with adults, but it's typically done with kids. Exposure therapy, I talked about in the behavior therapy lecture. So, exposure therapy is when you expose someone to a stimulus that they don't like. So, I talked about like planes. If you don't like planes, then exposure therapy would be us talking, talking about the airport, and then maybe I'd say, okay, your homework is you have to go to the airport and look at the planes, and then go into the airport, and and basically you'd be getting closer and closer, exposing yourself to the thing that bothers you, or the thing that you have a phobia towards, or that the behavior that is bothersome. Role playing and rehearsal is a big CBT thing where you role play situations. So if you want to have a conversation with your boss, your counselor might role play that. Like if you want to ask for a raise, a CBT therapist would be like, okay, well, I'm the boss and you practice on me. And then rehearsal would be where you'd actually rehearse that. Same with modeling, which is also a behavioral therapy technique where I might model specific behavior and then you kind of rehearse it back to me. So, some other techniques that CBT therapists use: journaling and thought records. There's a lot of thought records in these workbooks here. Um, Challenging beliefs. So that's kind of, again, kind of related to reality testing. So you might say to me, I don't think anybody likes me. And I would be like, well, is that really true? Do you have friends? Yes, I have friends. Have you ever asked them if they like you? Well, yeah, they like me. Okay, what you're telling me is like that no one likes you, but you have lots of friends. That's pretty inconsistent. So challenging beliefs is when you challenge people's beliefs that are usually false. Mindfulness, which is kind of, a skill a lot of therapists use, um, can be used in CBT more as a way of, again, like noticing, getting into your body, kind of out of your head, and also noticing thoughts but not following them. Mindfulness is its own thing. I'll probably do another lecture just on mindfulness, but it can be used in CBT. It's definitely used in DBT, dialectical behavioral therapy, which I can do another PowerPoint on if you'd like. Um, Relaxation and stress reduction. A lot of CBT therapists would probably do guided relaxation things where you'd be like, okay, sit here. We're going to take some deep breaths, like desensitization, relaxation. And there's also all kinds of other things that CBT therapists do: social physical thinking exercises. We're basically just trying to make people more aware of their emotional and behavioral patterns. That's pretty much the basis of CBT. So then I want to talk a little bit about a specific CBT thing that I actually was trained in about 10 plus years ago when I worked at Boston Medical Center, and it's called problem solving education. I probably could grab that sheet over there. Maybe I will. I don't know if it's worth it. But so basically, the whole idea of problem solving behavior or education is, first you identify a problem. So let's say the problem is, what is the problem? The problem is I need to get a job. So, or problem is I'm unemployed. Okay. And then make a goal would be like to get a job. And so then we brainstorm solutions, and it'd be like brainstorm solutions could be, rewrite my resume, or go back to grad school, or try a different field, or go on Craigslist, or go on Handshake, or whatever people do now. And then we go through the pros and cons of those different solutions. And then we would choose a solution. And it could be one solution, it could be two. So it could be, beef up my resume and then go on Handshake. And then we do an action plan, and we'd be like, okay, the first thing we're going to do is revise we're going to ask a friend to look at our resume, and then we're going to upload it, and then we're going to, etc. And the last one's pleasant activity. So when we did this, I actually did this as part of a research study. I did these worksheets for a couple of years with mothers who were in Head Start. And the research found that one of the most effective parts of this therapy was the pleasant activity, which is actually where you would just say, at the end of the CBT session, say something along the lines of, so what's a pleasant activity you can do for yourself? And these were mothers with single mothers, mostly with small children. And they would say, I'll go get a coffee with a friend, or I'll get my nails done, or I'll go buy a magazine I like. And that turned out to be a very effective part of the CBT solution, ironically. So anyway, here's an example of that. So defining a problem, a patient is struggling to maintain their walking program. Reasons given are pain and schedule conflicts. So that's the problem this client gave us. To select a goal, adhere to the original treatment plan, or establish a new goal. Then you talk about alternatives. So walk in the morning before lunch, or work, or at lunchtime to decrease walking time but increase the number of sessions. So you basically give them some options, which is the whole pros and cons thing. So like if you just say, this is what we're going to do, sometimes people are like, no, I don't want to do that. So then you say, okay, what are all the things you could do? And let's choose, talk about those and then choose one. So when you select a solution, the client chose, see, that's the main word, the client chose to walk for 15 minutes at lunch instead of after work. So they chose their own solution and they had options. And then you evaluate the outcome. So at a follow-up appointment, you discuss the change in the program and encourage that they adhere to that and adjust it as needed. So that's an example of like a brief CBT session. And then this is another sheet just to look at this. Again, CBT is very much about these lists. There's a lot of writing things down. So this one is like about automatic thoughts versus cognitive distortions and irrational response. So an automatic thought, again, this is like when we talked about earlier in a different slide about like changing how people feel or their opinions, the kind of reality testing. So an automatic thought, I can never do anything right. And so the cognitive distortion there is that's an overgeneralization. Obviously, you do some things right, not everything right. And so the rational responses to yourself is like, actually, I do a lot of things right. Another automatic response, I'm always late. Again, that's an overgeneralization. So I'm not always late. That's ridiculous. Think of all the times I've been on time. And if I was late more often than I'd like, I'll work on this problem and develop a method for being more punctual. So that's what a lot of CBT would be like, because a lot of times people say things in counseling that are kind of self-deprecating. They'd be like, no one likes me, or I have one client who's always like, I'm an idiot, and she's obviously very bright. So a lot of times I say to her, like, that's totally wrong. Like, why do you think you're an idiot? You went to a really good college, you have a really good job. Why on earth would you call yourself an idiot? So it's trying to make people more rational about the things that they say, because even if you have these negative self-thoughts, they're distortions. And so we're trying to help people come to a more rational sense of things. So that's really just, again, the CBT 101. There's a lot more to CBT. If you're interested in it, again, do some more research. If you're really interested, you should get some of these books, like, again, Cognitive CBT for Dummies, the Anxiety and Worry Workbook. These are the three that I've used the most. I have a lot of other sheets. I'll show you one other thing. This is a problem-solving worksheet right here. I don't know if you can see this very well, but that's where you put the problem, the goal, you brainstorm 5 different potential solutions, then you do the pros and cons. These are the pros, what makes this a good solution, then you check off the cons, then you choose a solution and you do an action plan. And then here's the pleasant activity part. So this piece of paper is basically what we did with all our clients. And I think it was actually really useful to some of them because it gave them a way of really having something written down.